Welcome back, everyone. Right now for you in Medical Rounds, September is Prostate Cancer Awareness Month. Hartford Hospital has a brand new virtual prostate cancer clinic that is changing patient care. Joining us right now is Dr. Ryan Dorin, a urologist with Hartford Healthcare Tallwood Institute. Doctor, thank you very much for talking with us tonight.
Oh, no problem. Glad to be here.
Well, let me ask you first, what are the signs and some of the symptoms of prostate cancer?
Well, in patients who have an advanced prostate cancer, one that's spread already or grown to a very large size, they can have weight loss, they can experience pain in the bones or spine, or maybe weakness in the legs, or may have trouble urinating. But most patients with a new prostate cancer diagnosis don't have any symptoms yet. And that shows the importance of screening so that you can catch it before it has spread, because otherwise you won't really notice it.
Well, as you know, a lot of people, I think, right now are afraid to go to the doctor, and the Hartford Healthcare Cancer Institute has a new virtual prostate cancer clinic. How does that work exactly?
Yes, so because of COVID-19, we had to move a lot of our consultations to telehealth, to online visits. And although we are back now seeing patients in the office in person, we realized that using this platform, the telehealth platform, was a very useful way that we could bring together a lot of different specialists to speak to patients about complicated health problems like cancer. Prostate cancer, for example, has seen so many advances in the last 15 to 20 years that in order to really explore all your options, you have to meet with a surgical specialist, often a radiation oncologist, and a medical oncologist to really explore all the available new therapies. And for most patients, that meant multiple office visits, having to travel to different clinics or even different hospitals. And clearly, that's even less convenient now than it used to be for patients. Additionally, because of restrictions we have now, patients can't really bring family members often with them to their consultations, which is really important for people to really get all the questions answered and understand their situation. So our urology cancer team at the Tallwood Urology Institute, Hartford Healthcare Cancer Institute, came up with this idea where we can now provide patients with this consultation format where, from the comfort of their own home, with as many family members as they want present, they can meet with a surgical specialist, like a urologist, myself, and my colleagues, a radiation oncologist, and a medical oncologist, all in the same visit. And the entire visit is on a Zoom meeting, and the Zoom meeting is hosted and curated by our special nurse navigator, Suzanne Carrier, who has oncology training, to help make it as smooth as possible. And in doing this, they're able to get all that information in a 1-2 hour meeting.
Well, it certainly sounds very thorough and effective at a time like this, Doctor. I have to say, lastly, I'm imagining you would encourage people to not put off treatment right now. You know, we hear a lot of these reports. People are afraid to go to the ER. They're afraid to go to their doctor. I'm sure you would think they should not be afraid, right?
Absolutely. We have protocols in place to minimize the risk as much as possible. Clearly, there's no way to make anything zero risk, but at this point in time, it's much riskier to sit on something that could be a severe problem. And then by the time you get around to taking care of it, it's not as solvable as it used to be.
Okay, Dr. Ryan Dorin, thank you very much for taking a few minutes to talk with us tonight. We certainly appreciate it. For more information, Hartford Healthcare holds a monthly prostate cancer education program. This is on the second Tuesday of each month. You can sign up by calling the number right there on the screen, 855-HHC, here.